All right. Welcome everyone to this webinar. I'm Linnea and I've been a part of the HackHERHealth project team. And together with Maria and Rocio, we've worked together on creating this challenge. So this challenge is based on their expertise from what they meet in their day-to-day life at their work at Sahlgrenska University Hospital. So how this talk is going to look like is they will present for the next 30 minutes or so, and towards the end we'll have time for questions. So for questions, please raise your hand in the chat, raise your hand or write a comment in the chat, and we'll make sure to raise your question. This session will be recorded, so you're aware. And Maria and Rocio, welcome.
Thank you.
Thank you.
It's a pleasure to be here with you guys. I'm Rocio Montejo. I'm a gynecologist at Sahlgrenska Hospital, and I work with Maria.
Yes, my name is Maria Hallingström. I'm a registered nurse and midwife. I've been working here at Sahlgrenska University Hospital since 2007. I have a PhD in medicine, and I've been working a lot with research and leadership, and built up, developed, and led a large research lab who's world leading in some research fields. And since almost 1 year, I am the project leader of innovation at the Department of Obstetrics and Gynecology and Reproductive Medicine here at Sahlgrenska University Hospital. And we will let Rocio present our challenge.
Yes. So I will share my screen now, and please, you are free to comment, to just questions, commentaries in the chat, raise your hand, whatever. So I hope that you can see my screen. Yes. Challenge: rethinking and innovating pregnancy and postpartum care in Sweden. But yes, we are in Sweden, so we think that it's important to start with some number here. And here you can see the number of the birth and death and the projection for the future. So as you can see up in the screen, around 100,000 birth every year. And we're quite lucky here in Sweden because we have more birth and death, not like in the south of Europe. I came from Spain, or there is worse. So we have good prediction in the future, and even the birth go up. So as you can see, the pregnancy and the pregnancy problems will be something even more important in the future. Is another really interesting number, especially here in Sweden. And you can see there the birth estimation for woman, mother born in Sweden, and a foreign born mother. And this, you know, when you don't live here in Sweden, it's possible that most of people think that the population here and the pregnant woman here is quite homogeneous, is quite the same. They think that they're just a Swedish woman, and actually it's not the reality, because they have a lot of women, almost one third, 30 of the women are not born in Sweden. And this suppose are different if we can compare with other countries, and also it's a challenge. And during the pregnancy, and I don't know if you have been pregnant or your partner, or you have been involved in the maternity and the paternity, and you can write in the chat. There's a lot of fears because when we are pregnant, there's a lot of things that can come in. And if we look into the literature and we try to understand what are the fears, so there's several. There's fear. There's a lot of question about the future, but let's think a little bit more. One of the most important fears is the baby's health. A lot of concern about potential health issues, genetic disorder, or miscarriage. This is really common. But also many fears about possible abnormalities and complication. And these fears, it's really special, important around the prenatal testing dates. So when you have to do an ultrasound, for example, it's worse because you can't stop thinking about it. Or even if you have to do some kind of test. So the fears are more important. And you have a lot of questions in your head, in your mind. There's another important fear can be the labor process. And here this fears of pain, complication, cesarean. About 20% of women, 1 of 5, have a significant fear of childbirth. And this is something that we see all the time. Isn't it? Maria, do you want to say something? Yeah? No? Agree?
I agree.
Yes. But there's another problem that it's important to think about it, especially if you have never been pregnant, but it is important. And it's, for example, the fear to body change and body images. Because the body change can change a lot, and you can put a lot of kilograms, and even you don't understand why, but it's happened all the time. So they can affect self-imaging, and there's a lot of concern, or even there's a problem if, for example, you have an anorexia or bulimia before the pregnancy. It can be worse because there's a lot of concern about the weight gain, probably to go up in the weight, but it can be also because you eat a lot of and you can't have more weight. But also there's other problem like skin change, like these things that can happen in the face with this smart barrier.
With the pigmentation.
Pigmentation, thank you very much. Yes. And there's a stretch mark in the abdomen, for example. And yes, and the postpartum recovery that most of us don't feel well because you feel that you have a lot of weight and you have the hormone downs, and it's quite difficult to have a good personal self-images. So it's quite normal. Other problems, yes, about the parenthood, doubts about being good parents, good mama, will be a good mama, can meet in newborn's needs. There's a lot of question with this. A lot of anxiety about providing education and protection, and this concern affect both women and partners. And in the end, but really important also, the impact of the pregnancy in the couple's relationship. A baby is a bomb, or can be a bomb in the couple. We know, because a lot of things change after the delivery, because there's other needs. So there's a lot of worry about how pregnancy and the baby will affect the relationship, the sex, the intimacy, and the dynamic of the relationship. So a lot of fears and question there also. And financial aspect. Here in Sweden, we have a really good protection and a really long maternity leave. So I think we are really, really lucky here, but it's not the same for others. And it can be also an important factor of anxiety. So, as you see, really a lot of doubts. What do you think? You somewhere here, do you have other fears that do you think is important? I can see the chat. Let's see it. Nobody write in the chat. I hope that you don't do a siesta. Nothing.
Can you repeat the question, please?
Yes. Do you think that there are more fears and question and problem during the pregnancy that are important? Okay. Do you think I covered the main point? Good. Okay. But now we are in Sweden, and in Sweden we have a specific problem. For example, I will tell you my example, and then I let the word to Maria. But when I moved to Sweden, I was in my 28th week of pregnancy, and I can't speak Swedish, and everything is new. So I start to bleeding, and okay, I go, or I don't feel the baby, so I went to Sahlgrenska hospital to this emergency room, and I say, okay, I'm pregnant, 28 weeks, and I'm bleeding, and they say, no, it's not here. You have to move to the Östra, to another hospital, because for me it was really, really difficult to know this. And we live in a structure that is not easy to understand when you are pregnant and you are not Swedish and you can't speak Swedish language. So it's one of the gap that we can find here in Sweden, and there's a lot more, but it's just an example. And now, Maria.
No, but I want to continue what you're talking about now, Rocio, because when you are pregnant in Sweden, we have well, it's very common that women are cared for within different healthcare systems, both during pregnancy but also during delivery and postpartum. And they meet a variety of healthcare professionals in different constellations. They go to the antenatal clinic during pregnancy, and they have one dedicated midwife there but they go, this midwife might have kids and might be home for sick leave. She will probably sometime during the year go on vacation. So they will meet maybe 2 or 3 midwives at that antenatal clinic. When they go for ultrasound, they go to Sahlgrenska University Hospital at the eastern part of that, and they come here and meet the people. If they have diabetes, for example, they might need to go to a special antenatal clinic. If they do ultrasound, they might do that at a private clinic or somewhere else. So it's quite many healthcare facilities to address, and quite many people to meet. And if you don't have confidence in that particular midwife that you meet at the antenatal clinic, or if you feel that you meet too many persons, it might make you feel overwhelmed, insecure, uncertain, especially based on the things that Rocio told us about before, that it's very common that they experience, that these pregnant women experience both physical and mental symptoms and emotions. And they have a lot of questions, a lot of concerns, and it's hard to know where to address these. So I think that the basis of our challenge is to help women to find that structure and to find that secure point, or whatever it might be, that will help them to feel safe, well-informed, secure, not so overwhelmed by everything. So we envision some sort of developed structure that enhance both patients, pregnant women, their partners, their families, siblings, but also physicians. We envision a 24/7 support throughout this whole time period, from pregnancy to delivery to postpartum period. And we want this support to inform and advise women. We want it to be based in evidence-based medicine. We want everyone to have the same information, no matter if they speak Swedish or any other language. And as Rocio said, it might be even more difficult and challenging if you don't speak Swedish. So we need to make sure that they get the same information, which is not the case today, because we use translators, but we don't use translators for everything because it's so comprehensive. Yeah, I think they need to know where to turn and what to do, and have that continuous support.
Exactly.
And I
Exactly.
think based on that, we've gotten a linked question in the chat.
Yes, the cultural. Yes, that is. I think that we can ask a little bit with the next slide, actually. The cultural. It's a quite important problem, because we have a lot of women that we have seen in the previous slide that not born in Sweden. So almost 30% of women. And one of the most important problem is actually the don't speak Swedish, like Maria said. So we have a problem because the language, and this is really a big barrier because if you can't speak Swedish, so you miss a lot of information. And we have really people from everywhere here, from Africa, from Asia, so quite a lot of different cultures. And sometimes we have a problem just with the language, but even if we have a possibility to have a translator for a woman, for example, we have a woman that can be mutilated, that have a female mutilation, and it's quite difficult to find a good translator in Somalijska or Tigriska. And if we can find somebody but is a man, it will be a good problem, a big problem, because it's difficult to accept that a man translate the conversation between the midwife and the woman. So it's a challenge, not just the language, it's more the communication. And then we have other realities, because we have also men that can be pregnant. We have more and more trans men that are pregnant, and it's important to know. Maria, do you want to say something?
Sorry, I was just going to say that a translator, if you hire a translator, that person will just translate exactly what you say. But what we envision is someone that translates also to help them interpret what is said, to help them understand the bigger picture of what is said. And I think that's very important, because when you only have translated some part of it or exactly what is said, you might not get that bigger picture. One other challenge with this intercultural communication challenge that we see is that if you are born in Sweden, you kind of know the healthcare system, because you go to different healthcare providers since you are born. So you do know that there's a primary healthcare system. We have Sahlgrenska University Hospital. We have the primary. We have the antenatal clinic. So you kind of know how things are working out. But if you're brand new in Sweden, it's very, very hard to understand all these different care units and care levels.
Yes, it's almost impossible. I know. Yes. Even for doctor, it's not easy to know, because sometimes I work like a gynecologist, and I don't know if where I can send a pregnant woman if it's between 17 weeks of pregnancy of 75, because I know that there's a different place. So every time I meet somebody in the emergency room or in another place, it's quite difficult to understand the system. Mm-hmm.
And the problem is also that pregnant women might have several symptoms. They might have fever, but you don't know if the fever is based on an if it's combined with a sore throat or cough. So because then you should go to the primary healthcare center. But if it's something has to do with the delivery, you should go to the antenatal clinic. So sometimes it's hard also to diverse where to send the patient and where to seek care, and you might need to go to several places for similar symptoms.
Yes, and important here in Sweden, because maybe somebody here that it not live here. In Sweden, you can't go to the hospital. You need to ring the hospital before. This is quite different in other countries. You have a fever, so you go to the hospital. Not here. Here, you must to call, and they recommend go, not to go, wait, etc. So it's quite different.
So we have another question there, Rocio. They ask if all healthcare providers use the same system for reporting in the journal. So even if the pregnant women meets different personnel, do you all see the same information? I would say
no.
Sometimes and sometimes not, because we use Obstetrics as our chart, medical chart, a medical record. And that is quite common. We use it at the antenatal clinic and we use it at the hospital. But if they go to a primary healthcare center, we do not see that journal. If they go and take blood samples, we might not see that either. And also there's a medical record for the children, which is Melior, which we do. We can access it, but it's not the same medical system. So we might end up with some issues or problems with that as well.
Yes, and we have a different system between different regions. So if you go to Stockholm, it's not the same.
No, that's true.
So yeah, it's another challenge. Yes.
Definitely.
Yes, and we want to share with you a little bit of the information that you can find in the internet, and this is the system, the 1177. And I think you are best to explain, Maria, how this works, because we have this information about the graviditet.
Yeah, it's also you can also find it in English if you just access 1177.se. And you can find information here about the pregnancy and the delivery and the postpartum period. And we have started to develop a platform based on 1177, which we straight translated from Swedish, we call it midwife in your pocket. And it's a platform where we have started to work on this project. And what we would like you and your teams to do is to take this to version 2.0 and to help us develop this to a smart technology that will provide pregnant women during pregnancy, delivery, and postpartum period with some sort of feature, some sort of human-like feature. We envision some sort of doula, similar to a doula. I hope everyone knows what a doula is. It's someone supporting during pregnancy and delivery. Well, they provide the pregnant, laboring, and newly delivered women with adequate information and these continuous real-time support. And we do think that if women had such an advanced and smart support, the healthcare contracts would decrease and they would feel more secure. And that would save our limited resources on the healthcare system, which is very, we have a lot to do here. So, and what we also would like to give you or to tell you is that Sahlgrenska University Hospital has a special focus right now on sustainable outcome variables such as the right level of care, safe patient, and care at home. And we envision that this the outcome of this challenge will address these variables as well. I think that we have another question here. It's this.
With this knowledge source, yes, you can just by Google and you can see it. Same information.
Just go to 1177.se.
Yes. Yes, this is the challenge. And I would like to say one more thing, and maybe we have been quite focused on the pregnancy, but don't forget the postpartum, because during the postpartum also there's a lot of questions, a lot of problems with the breastfeeding, with the pelvic floor injuries, a lot of women that have a problem with the pelvic floor, and they don't know what to do with this. So the pregnancy is important, but after the pregnancy, there's a lot of things that are really, really important. So please,
and that's really
don't
important.
forget.
That's really, really important, Rosie. And also, there is also the challenge that they experience during a pregnancy, that they don't know where to seek care, because we have a breastfeeding unit where they come for breastfeeding, but they don't help with the pelvic floor. Then you need to go to another specialist. You might need to go to a gynecologist. You could also go to the newborn department. So there are so many instances to go to, and especially during that period, you're very, very sensitive as a woman. It's a lot of hormones and hormone balances that are not very easy to handle. So they do need support, especially during this time period as well. Let's see, we had a question about, let's see, is there a local NLP ready source of such knowledge available? It says.
And I think there's these questions are great and continue to populate the chat. You can also raise your hand if you want. But just like Maria said, we had a question here saying, is there a local NLP ready source of such knowledge available? And I think unless Rocio or Maria have an answer, could be that our colleague Martin Preisner might know this.
Sorry, can you repeat the question?
Is there a local NLP ready source of such knowledge available?
So we will provide you with a knowledge base about the pregnancy challenge. So we basically took all the resources that we could find about the pregnancy challenge that we have and put it into a knowledge base, which you will be able to use with the Bing AI Copilot in an interactive way. So this will be available, but you can always be free to basically search for additional information. And obviously, there will be more, like Rocio, I think, will be in person there or online at least for further support. So definitely, I would recommend reaching out to experts to get their hands-on experience for this challenge. Yes.
Yes, more specific question. We can find more evidence or more, but yes, it must be more specific, and we have a lot of protocol and yes, guidelines. So it's not a problem.
And I think this lists an important aspect that we'll have access to mentors during the weekend. And for this challenge, we'll have Rocio. We'll also have 2 midwives joining us, as well as the improvement leader for the unit. We also had a second question saying, can you provide more information on the sustainable outcome variables?
Yes. So there is something called Sahlgrenska at home, which you can Google and read more about. So what we do want is that the patient, it goes hand in hand with this right level of care and safe patient. We want patients to feel safe and secure in their own home so that they can stay at home as much as possible. And we also have projects where they, for example, have their babies get sun. What is that in Rocio? What do you call that when they after delivery, if the baby has a yellow tone, they get
ictericia. Ictericia.
Yeah,
It's Kevin in Spanish. Sorry. Ictericia. I can try to.
Well, they need a special light to decrease the I don't know the English word of this. Well, anyway, they can get this special light at home. We call it Sola hemma, sun at home. So you can find more information about it if you just Google it.
Jaundice.
Yes.
Yes. And another question is
light,
that
yes,
can you find such information about, for example, postpartum issues in 1177 as well, or in another source?
Yeah, I think you can find it at 1177, or even if you just Google postpartum issues, you will find them there.
Yes, there's quite a lot of information there. But always in Swedish, or in the best case scenario in English. So yes, not for everybody.
Any other
So
questions?
This is a great opportunity to ask anything you might find unclear about the challenge so that you're ready to start working right away tomorrow.
Yes, and if you have practical question, the midwife that will be mentor have a lot of experience with this, and is Anna Lendalberg, yes, and Camilla Olaf.
Yes, Camilla Olafsson and
Olafsson.
Annelian Dahlberg are midwives. Rocio, you meet here, and we also have the head of department. Both she's the head of Department of Obstetrics and Gynecology and Reproductive Medicine, Corinne Pedoletti. She will also be the mentor. So I think that if you have questions concerning the women's experience and the women's physical and mental symptoms and emotions during pregnancy and delivery and postpartum period, it might be good to address these to the midwives. If you have, yeah, great. Thank you, Sylvia.
Yes,
if you have any questions regarding medical conditions or the healthcare system, it might be better to talk to Corinne or Rocio.
If you have a question about the system, Corinne is the perfect person because she can everything.
Yeah.
And if you need the protocols or guidelines or more literature, I'm your person. So I can help with this.
Is it clear for you what we envision for your participants? Any questions about that?
All right. Anything else that we want to mention from your end, Maria and Rocio? Or should we have one final
Let's
question?
do something good because we need it.
Yeah, and I think what you lifted it really shows the complexity of the pregnancy workflow. Oh, we got another question. Can you expand more on what you've already done, referring to midwife in your pocket?
Yeah, so what we've done is to develop a platform which is based in 1177, and we have made sure that women get information there, which is they have the same information. However, it's only in Swedish, which is a limitation, but they get information about different conditions during pregnancy, different physical, mental, emotions, problems you might have. It's evidence-based medicine, but it's quite, how do you say, it's quite fixed because it has 1177 as a base, and you need to enter there to get that information. But it's nice, but it's we want it to be a little bit more flexible, a little bit more to address all women in all different conditions and positions and in all languages. But it is a 24/7 support that you can access by logging in.
Great, thanks. And next question, what do you think is the main reason the women that are born in Sweden not struggling with language? So what is the main reason these women struggle to find information about issues during pregnancy or postpartum?
This is a really, really good question because they have a lot of information, but maybe we need to do it more attractive. And sometimes it's easy to look in the Instagram or Facebook that in a public website, and it's quite sad, I think. But sometimes I think we don't do a good marketing with the good information, and we need to do more attractive. And then we need to provide something easier to look on the information, because we just go there to the El Bajo Tejo, and you have to go through 1,000 pages to find your information, probably it will be not easy to find. And I think this is one of the problems, that we need to do the information more accessible, more easy to find, and more attractive.
I think also one issue is not that they struggle to find information; they struggle to diverse information, to understand what information is what, because there is too much information. And it's not that they struggle to find some information; they get too much from too many different places. So they don't really know where to seek information, what to listen to, what to not listen to, what is evidence-based medicine and what is not. And it ends up sometimes with having questions in a Facebook group or asking questions there and hoping for responses. Or so we need to make it easy for them. It should be one place, one feature that they know that they can rely on, and they know that this information is really the only thing I need. And it would be fantastic, as Rocio says, if they didn't need to go through document after document after document and texts after texts to try to find the right information, but to only ask a question, or to only, if this features can ask questions or can answer questions or can find the relevant information to help the women, to facilitate for them, and also for the partners, of course.
Great. I think we have time for one more question, and then we'll wrap up. So while we're waiting for a final question, I'll just briefly mention that today before 5 p.m., you need to have signed up with a team to enter the hackathon. So at our platform, Event Tornado, you can read up on the team formation process, and we need teams from 2 to 5 participants. And we know that there's still a few of you out there who have some team formation left to do. So please just check out the website. And any final question? If not,
you're also very welcome to unmute and discuss the things with us. That would be nice to hear your voices.
Yes.
Yeah, if you want to have a interaction, you can just raise your hand and we'll let you unmute. So we have one question. I imagine that evidence-based information is gathered in the Western civilization. Would you want to? Oh, we have someone raising their hand. But let's first follow up with this. So would you want to just elaborate a bit on your question, Tanya, the question in the chat?
Hi. Can you hear me?
Yes.
Yes.
Great.
Hi.
Yes.
Hi.
Nice to see you.
Nice to see you. So I was just wondering about this evidence-based information, because I assume that this information is gathered from these industrialized countries, the Western countries, no?
No, actually, yes, I do quite a lot of research about the pelvic floor injuries, for example, and there's quite a good studies that show the difference between, for example, pelvic floor injuries in ASEAN or Caucasian, or so there's quite a lot of good literature there. Also in preeclampsia, eclampsia numbers, there's different. With the different ethnicities, etc. So yes, there's quite a lot there.
Oh, okay, because I received feedback from a friend that the healthcare system, when you are giving birth, is so very standardized. And for example, the information about breastfeeding and using bottle feeding for the infant, that there is not much flexibility there, and maybe because the studies are based on the, I don't know what really, but it doesn't give. I mean that the baby will be fine even if you give feeding from the bottle, but it seems like it's very
yeah. I understand what do you mean. What do you mean? And we have a really big gap between man and woman, and yes, and in minorities there's a lot of lack of studies. Yes, this is absolutely true. But then we have quite a good studies, not so much. I hope there will be more in the future with other population. But the breastfeeding, for example, we really want and stuff. What's the name in English? We are really want to increase the breastfeeding, the maternal breastfeeding. So, but I don't know what happened with all the person that work in the hospital. So it can be more individual problems. So you have not good luck and you find not the correct person. But in the institution and the hospital, we really fight a lot to promote the breastfeeding in Sweden.
Great, thanks.
I would just like to add as well that the information at 1177 is evidence-based.
Yeah, thank you.
Thank you.
So thank you. Let's move on to the next question. We have Anna Paula. And you do you want to raise your question? I think 1 second.
You need to active her, I think.
Yeah.
Okay, great.
Hi, nice to meet you.
Hi, nice to meet you. So I have a question because I don't have kids, and so I don't know how it works. But my main question is, nowadays, how do midwives communicate with the expecting women or postpartum? How does it work, the communication nowadays? Do expecting women have their doulas, midwives phone, or how does it work? They call the hospital?
Most they go there for physical visits. So they go to the antenatal clinic, and there's a special program that they follow. So they go there for a first visit around gestational week 4 to 6. Then they come at the next appointment, which is around 10 to 12 weeks. The next one is around 20, and then we have 25, 28, 30, 32, and it goes, it's more frequent the longer you get in the pregnancy. But it's physical visits. Then they have the telephone number for that antenatal clinic, so they can call there and ask to talk to the midwife, and she will call you back.
Okay, so nowadays
you can also call the hospital, but it's not. We don't have like chat systems or any other interactive.
Okay.
Oh, no.
But you can also communicate through 1177 and leave a notice or a little. You can send a little message there to your midwife, and she can go in there and respond, and you have an SMS saying you have a new message in 1177. So it's quite
broken, I would say. This communication's kind of not directed to the person, and
exactly.
It takes a while. And would you like to have some tool that would address this problem?
Yes.
And like something that maybe the person can talk to the doula, or at least exchange some messages, a channel, like a tool that you can connect to the doula through some app, something like that. Would you think about something like that?
We envision a continuous real-time support 24/7 on their selected language. Definitely.
So
But
let's
we don't have any doula in the system.
No.
No.
Doula is a private thing. So doulas don't exist in the system. If you want a doula, you will have to find one yourself if you're pregnant. Then you will need to hire a doula yourself.
Okay. Different from my home country, very different. I'm not Swedish. So let's imagine throughout your the moment you were expecting your baby. So these visits, you have to call the hospital. You don't have a person, like a personal physician, a personal nurse or midwife follows you.
Yeah, you have the personal midwives at the antenatal clinic. You have one midwife that you go to for all these visits, as long as she is not sick or has sick kids or go on vacation or so, because then you have one of her colleagues.
And I think a point important, especially if you don't live here in Sweden, is to know that you don't meet a doctor in all your pregnancy if you are a healthy woman.
No. And not during delivery either. The midwives deliver the patients in Sweden. So if you are completely healthy and you don't have any complications during pregnancy, delivery, and postpartum period, you only meet midwives. So the midwives do the ultrasound as well.
Okay, so let's move on to our last.
Thank you.
Thank you for the question.
Thank you.
Let's move on to Angiota's question. So now,
can you hear me? Yeah.
Yes, we can. Great.
Oh,
yes.
Let me open my.
Nice to meet you
camera.
as well.
Yeah, nice to meet you too. Thank
Hi.
you for all good responses in this presentation. So one last question. I know that you can call into 1177 to ask like different questions, and it's not like a midwife answering them, right? But still you can call them. But do you have, I mean, is there any statistics available to see like how many calls they get connected to pregnancy issues or postpartum issues, and to see, I mean, how many hours they spend to answer on these questions?
Not that I'm aware of, but I'm very sure that they do statistics on their material. I'm pretty sure that they do. How do you say? I'm pretty sure that they will gather information about that. Why do women call, or why do people? Because it's not only pregnant women calling there.
No.
It's the whole population calling there. So I'm pretty sure that they have statistics about that. But I think that's a question for 1177.
Yeah, maybe. Yeah.
I'm not. I don't know that, unfortunately.
No. Okay. Thank you.
Do you know any of the Rocio?
No, I suppose that it will be available information probably in the El Bajo Tijú, but I don't know. Probably we can ask somebody, but it would take a few weeks.
Yeah, of course. I was just wondering if there are any available, but never mind. It's okay. Thank you.
I think that
I think it's a great question.
I think that if those questions come in there, because mostly it's nurses who answer these questions at 1177. It's not midwives, it's nurses. And I think that if a specific question comes in that they can't reply or respond to, they will make sure that the women get some sort of help somewhere else. So they will tell the women to call here or go there or.
No, but why I'm asking is because, I mean, you were talking about that people or pregnant women, for example, the case you mentioned there also in the beginning, when you came to the emergency, then they told you can't like get any healthcare here. You have to go to another place. I mean, maybe someone is calling in and asking for some help and not calling to their midwife or the prenatal care. So that's why I'm wondering. But yeah, I mean,
great.
Yeah, maybe we can ask the question to 1177.
Yes, for sure.
Thank you.
We need to wrap up. So thank you for thanks everyone who's been interactive, asking questions, and a huge thank you to Rocio and Maria who have giving us a little bit more information about the challenge. We will share the recording later, so that it's accessible to all teams. And thank you.
Thank you.
Good luck, everyone. We look forward
Good
to the
luck.
results, to your project ideas.